Here's your big baby blues take-home message. Ding, ding, ding. You would be right.
Worst. Number one answer I've ever seen.
Dogs being yeeted. Lucky us. Slap a Band-Aid on and poof, be gone sort of solution. There's something that's affecting tons of people worldwide. We need to talk about it. Baby blues versus postpartum depression. First off, can we please erase the taboo that still exists around mental health? Postpartum depression, it's a depression that happens after you have a baby. But we've been told our entire lives, becoming a parent, becoming a mom, it's amazing. You're going to love your baby, have this beautiful bond. But then why, when 1 in 8 women, and even higher in some US states, experience postpartum depression, is it still something that we're sort of tiptoeing around? So please help me spread this information. I experienced postpartum depression 6 years ago. I still struggle with depression here now today, and this is the information that I would have loved to receive during those darker times in my postpartum journey. So are baby blues and postpartum depression the same thing? And no, they are not. The biggest difference that is reported is the severity of the symptoms people experience and the length of time for which they experience those symptoms. And this is why it is so important to check in and continue to check in on your mental health and your mental well-being after you have a baby, and also why it's important to include your village in those conversations. And then that way, if things are shifting or going on longer than we would expect, then everybody is in the loop and we can all help you together. Baby blues, they affect around 30 to 80% of new moms, and these are still feelings of sadness, and most times this comes on within 2 to 3 days after your baby is born, though it can go on for upwards of 2 weeks. Now, here are some examples of symptoms that people with baby blues might experience, but again, everybody's going to experience this different. And that's important to note, that baby blues, they're going to affect everybody, every age, every race, every culture, every economic status. And I want you to know that if you do experience baby blues, you did nothing wrong. Now, the thing with baby blues is these symptoms, they will go away on their own within about that 2-week period of time after you give birth. And you're going to see later in the video, that's very, very different from postpartum depression. If you guess that hormones are to blame, ding, 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 you would be right.
Worst. Number one answer I've ever seen.
After you give birth, your estrogen and your progesterone, they take a big old dive, like right off the cliff, like where did you go, estrogen and progesterone? And if you combine that hormone shift with things like not sleeping well, not eating well, the stress of becoming a new parent, maybe you are worrying, all of those things sort of get added up into the soup. Oh, also some people's thyroid hormones, they also follow suit, and they just jump right off with estrogen and progesterone. And all of those things can contribute to those feelings of sadness and those mood swings. Because, hormones, yeah, lucky us. Interestingly enough, this does not only affect women. Upwards of 10% of partners report feeling those baby blues themselves, and it presents a bit differently. You might see some of these things happening in your partner if they are experiencing some baby blues. But you can imagine, if you are not feeling yourself, if you are feeling those mood shifts and feeling maybe sad and withdrawn, and then your partner is feeling these things, and they are also maybe irritable or withdrawn, they are going through changes as well. You can see how that really can sort of spiral really, really quickly. And this is why communication is really, really important, especially after you have a baby, especially after you have those hormone changes, especially after your entire life, you and your partner, have changed so dramatically. I have seen a lot of new parents go through things like these. My name is Tina. I am a certified perinatal nurse. I am also a certified breastfeeding specialist, and I am a mom of 4. If you are new here, welcome to it. Throw on those notifications. Consider subscribing. If you're not new here, welcome back. I love to see you. Let's talk more about baby blues and postpartum depression. If you do have a baby, and like a lot of us, you do experience these feelings of baby blues, here's a few things you can do to maybe lighten that burden a little bit. First off, you can improve your sleep. Now, this is not going to be like improving the quantity of sleep. We're talking quality here, because a lot of times you're not getting large chunks of sleep. But the sleep that you are getting, if you can make it better sleep, you'll likely feel more recharged and feel a little bit better. So lean on your village here, allow them to take care of baby so that you know they've got baby. you can just sort of plug in your earplugs, put on a mask, close the blinds, really take all distractions out, and really make sure that that chunk of time where your baby does not need you and is well taken care of, make sure that that sleep is really, really great. You can also make sure that you are hydrated, of course, especially if you are breastfeeding. And then your nutrition. I know that your nutrition is going to be hit and miss because you're a new parent and you're up all night. I get it. I ate like all sorts of really stuff that wasn't great for me. But if you can try to incorporate some foods that are a little bit better, a little bit more wholesome to give you some more of those nutrients, that's a really great idea. You can also try to get some fresh air. So this can be walking with your baby in a stroller, or again, this can be having somebody sit with baby while you go outside, even sitting on a park bench, getting some sun and fresh air for even 15 to 20 minutes. You can also look into support groups. There are a ton of support groups for new moms. There are new moms groups in the neighborhood that you can do in person. There are virtual ones. There's lots of resources online for people that you can talk to about what you are going through. And then lastly, really incorporate your village. Take anybody who is close to you that cares about your well-being, keep them in the loop in the conversation, and just say, hey, I need a hand here. And then they can help you do the things that are falling off that are likely making you feel more anxious because you're not getting to them. Here's your big baby blues take-home message. The symptoms you're experiencing, they should not be so severe that they're getting in the way of you doing your everyday tasks. And they should be temporary. They should be going away on their own without treatment within around that 2-week period of time. If your symptoms are getting worse instead of better, if you are feeling more severe symptoms, if you are unable to care for yourself or your baby, chances are we're not talking baby blues anymore. Chances are we're moving into more of a postpartum depression situation. And in these situations, it is incredibly important to talk to your partner, to talk to your village, and most importantly, to talk to your medical provider, because we need to get you the help that you need to get you back on track to enjoying your life with your new baby. Postpartum depression, this is so important for me to talk about because it affects so many people. I just want to shout it from the rooftops. So if you can help me shout it from the rooftops, I'd be very thankful. This is a type of depression that affects people who have had a baby. Very often it presents as these intense feelings of fear and anxiety and worry and sadness. Very often this gets in the way with people taking care of themselves or their babies or doing the daily tasks that they need to do to get through the day. Now, most often this will affect people around 1 to 3 weeks after they have a baby, but this can come on upwards of 1 year postpartum. PPD is likely caused by very similar things that cause baby blues, so those big fluctuations in your hormones and lots of life changes. But there are some risk factors that put some people at a higher chance of developing postpartum depression. A big one here is anxiety. There's been lots of people diagnosed with postpartum depression who also have an underlying anxiety disorder. There is a link between very young, under 20, and very old, over 40. And then, of course, lifestyle comes into play. Lots of people report when they have difficulties with parenting, difficulties raising a baby, or difficulties breastfeeding, which we know a lot of people do have trouble breastfeeding, that can contribute to developing postpartum depression. Everyone's different, right? So it would make sense that one person's symptoms of PPD are going to be very different than another person's symptoms. And in general, people report those intense feelings of sadness and fear and worry and anxiety, but these are also symptoms of postpartum depression, or how people report that they feel with postpartum depression. So I want you to know that just because you're not ticking off this checklist of symptoms that you would have if you had PPD, that doesn't mean that you might not still be suffering from postpartum depression. So if you are feeling a certain kind of way, you're feeling off, you don't feel like yourself, you don't want to get out of bed, you're not really feeling bonding with your baby, and you're thinking, it's been 2 weeks or a week and a half or 2.5, 3 weeks since my baby was born, I just still feel really off. I want you to tell someone, tell anyone, tell a friend, a family member, tell your partner, your spouse, tell a member of your church, a member of your congregation, tell your therapist, very importantly, tell your healthcare provider, because postpartum depression is not something that you just have to suffer through. This is not something that just happens because you had a baby and you'll get over it. Absolutely not. This is not something that you did, but this is something that is treatable. This is something that we can work through to get you feeling that joy, to get you feeling that connection and enjoying this life with your new family again. Very importantly, some people do report feelings of harming themselves or harming someone else or harming their baby. In these situations, it's incredibly important to activate emergency response or to call 911. So I want you to communicate well with your partner, and I want you to keep that line of communication open with how you are feeling and get the help that you so deserve. So if you tell somebody and you see your provider and then you get diagnosed with postpartum postpartum depression, what is going to happen then? And there's definitely different treatment options available, and that will vary person to person. First off, there are some great therapy options out there. I can tell you firsthand, I loved my therapist because she got me and she got postpartum depression. She's an expert in this area. And that's a really important key point here. If you find a therapist, you really got to make sure you gel with them. The vibe has to be there because you need to be able to trust them and be comfortable in that environment to really get vulnerable and to work through some of the things you need to work through. So it might take you a couple of tries to find the right therapist, but there are lots of different therapy options out there. There is also support groups out there. There is online support groups out there. There are in-person support groups out there, because remember, you are not alone in this, and we can sort of help ourselves to get through it with the help of a village that understands where you are at. And then of course there are medication options as well. Medication options might include antidepressants, and if you have never been on an antidepressant, I need you to know that they do come with side effects. The way that my doctor explained it to me, there are acceptable side effects and there are not acceptable side effects, because some medications might actually make your depressive symptoms worse, and that is not an acceptable side effect. Like dry mouth, it's probably an acceptable side effect. Feeling worse than you did before you started your medication, not acceptable. So just be really aware of that you might have to try more than one antidepressant before you find the one that works for you. With antidepressants, as with any medication, do let your provider know if you are breastfeeding. And then that way you can factor that in when you make the best decision for the medication for your specific symptoms. The other option for medications might be estrogen therapy. And that is because, remember, after birth, your hormones sort of do that big cliff dive, into the abyss. And so if your fluctuating hormone levels are contributing into your medication and your doctor thinks it's appropriate, they may want to prescribe that. Postpartum depression, it is complex. There's never going to be one magic, slap a Band-Aid on and poof, be gone sort of solution. However, it might always be in flux. So you might start off with medication and therapy, and then you might have medication and a support group, or you might have therapy and a support group, and you can see where I'm going. It might always be changing. The important part here is to communicate how you are feeling. Communicate with yourself. Be like, how am I doing? Check in. Communicate with your partner, with your village, and very importantly, communicate with your provider so that you can keep those therapy options moving in a direction that's really, really helpful. Also, we need to not only just sort of work on therapy, we need to make sure we take care of our body as well. So while those things are happening, if you can, try to hydrate, try to incorporate some of those good nutrient-rich foods, try to get some sunshine, some fresh air, and try to improve on that sleep like we talked about in Baby Blues. Even though it's more rare, I do want to mention postpartum psychosis. This is going to affect around 1 in 500 to 1 in 1,000 new moms, and this is a severe form of depression that requires quick, immediate medical attention. Now, here are some of the symptoms of postpartum psychosis, and if they do present, they usually come on with around 2 weeks after birth. Now, this requires a 911 call because the sooner we can get these individuals help, the better. I do think it's important to leave you with some resources and support, so you'll find all of these in my caption as clickable links if that's a little bit easier. First website I would love you to go check out is March of Dimes. That's where a lot of these support websites came from. They are marchofdimes.org. Just a bunch of really great pregnancy-related information, and they have a ton on postpartum anxiety and postpartum depression and postpartum psychosis and baby blues, so definitely head there if you're looking. Then postpartumdepression.org is another really great, reliable website that you can gather some information for. And if you're looking for something local, something specific to where you live, the best person to check in with is likely your provider. They should have a list of local resources. And this was a really important but also a really heavy video, so I appreciate you being here. If you want something that you can just zone out that has nothing important or serious in it, this one right here. This is just a whole bunch of reactions to, gender reveals. Just dogs being yeeted, and I promise nothing heavy there. So if you want a little checkout, there's a video for you. If you like this one, give it some love. Please share the word, share the message around. And as always, be happy, stay healthy, have fun.